What is gum disease? To know what gum disease is, you first have to know the anatomy of a tooth. A tooth itself has three layers: an outer layer, which is solid white, an inner layer, which is yellow, and the nerve, which is red because there's blood supply. The nerve travels through the roots of teeth. These are the roots of teeth, and those roots are embedded deeply inside your jawbone. This whole yellow is your jawbone. The bone is what holds the tooth in place so that as you're chewing, the tooth does not move side to side. And the gums sit over the bones, protecting both the bone and the tooth. And in a healthy environment, there's supposed to be no space between the tooth and the gum. However, you develop gum disease when you have bacteria that sit right by the gums and they release toxins that separate the gum away from the tooth. If you look at your left side of the screen, you see that there is a gap, this whole distance between the gums. This is a space that bacteria sit in and they separate the gums away from the tooth. This pink stuff right over here is your gums. Now, how does a dentist find out if you have gum disease? Well, the dentist takes a tool called a periodontal probe. That's this tool right over here, and it's got little measuring lines. So fancy name for this tool and easy to remember is it's a ruler. A ruler to check how healthy your gums are. Now, the health of the gums is measured from the top of the gum to the base. Ideally, in a healthy environment, you're supposed to have only 1, 2, or 3 millimeters of depth. Now, unfortunately, when you have bacteria or debris, this yellow gunk over here you could call is debris mixed with bacteria. The gums separate from the top to the bottom, and when we use what's called a probe or a ruler, we check the gums, and if we get depths of 4 millimeters or 5 millimeters or 6 millimeters, we know you have what's called gum disease. Now, a dentist that sometimes talks about gum disease, they might say, hey, you have periodontal disease. Perio is a simple fancy name that means around. Dental means tooth. So around your tooth, there's something wrong. A fancy name for periodontal disease is gum disease. So when a dentist tells you, hey, we've checked your gums and your gums are 5, 6, maybe 7 millimeters deep, what they're trying to say is the space between the tooth and the gum is wide and you're getting food and debris stuck in there. Now, some of you might wonder why 3 millimeters is healthy and why 4, 5 is not. Others might say, hey, what do you do when you have 6 millimeters or 7 millimeters? What if you have 9 millimeters?